My personal opinion, having had finasteride, minoxidil, saw palmetto, pumpkin seed extract, having had all of these things, and unfortunately having suffered, post-finasteride syndrome and having had finasteride-related side effects, minoxidil-related side effects. So people get started on doses which are too high, that they're taking too often, and they get started on the oral version, not the topical version, and they don't even get tried on any of the alternative natural routes. So I'm a big advocate for, if you find actually that you're not stabilizing the loss after 6 to 8 months, then it's really important that then you would look to potentially introduce anyone who's watching this that might be interested in learning more about hair loss. We have a hair loss ebook, which was produced by a medical board, which has over 75 years of experience, and this can guide you through all the various treatments that are available. Hey guys, Dr. Jonathan Hopkirk here, hair loss doctor based in Sydney. Now today I wanted to answer a really important question that one of my viewers had put through previously, and I'm going to read it out because I really want to break this question down, because I really feel for this person. I've been in this person's position. They're losing their hair, they're getting lots of different pieces of information from the internet and from other people that have treated hair loss, and they don't know which pathway to take. So I want to break this question down into different bits, bite-sized bits. So one, we can inform obviously the person who's asked the question, but then it can just give us a little bit of general information around certain details around hair loss and DHT and finasteride and dutasteride and what to do and when. So the question is, I'll read it from my phone because I want to make sure I get it exactly right, but it'll be up on the screen. Amateur the hour, there we go. I'm so confused. Someone is saying that the problem is DHT. Another is saying scalp tension. I've done blood tests. My DHT is very low actually. Another one is saying a lot of supplements. Some people just take finasteride and they're okay. So there is a correlation with DHT. All right. So I think what's really important first off is to understand what the implications are of DHT within the hair loss space. So DHT is it's a derivative of testosterone. So and it's both in males and females, but if we just focus on male pattern loss for the sake of today's talk, because this came from a male patient, DHT is a derivative of testosterone, as I was saying, and it's a potent derivative which has utility in your body in a lot of different ways, not just impacting hair, but it helps us mature when we're in the womb. So it helps us develop male genitalia. It helps us in puberty with some of the masculinizing effects that happen as we go through puberty. So growth of hair on our chest and legs, armpits, these sorts of things. And it also has some implications in adulthood with respect to memory and cognitive function. Now, DHT has this really fascinating effect in our body, and that it's paradoxical in nature, that there is a sensitivity to DHT as a hormone from about four finger widths or four finger widths above the ears upwards. And when you have this sensitivity, DHT can actually have the opposite effect on the hair on the top of your head versus what it does for the rest of the body. So everywhere from hair down, it will actually help grow hair after puberty or going through puberty and thereafter. Whereas from the age of 20 onwards, you've got 1 in 5 men in their 20s are losing their hair, balding, starting to bald. 2/3 of men by the age 35, 36 will start to bald, and then it's upwards from there. So DHT sensitivity from hair up will lead to those hair follicles producing progressively finer hair, shorter hair over time, and that's because DHT miniaturizes the follicle, which I'll talk about next. But DHT in itself, which is thrown around a lot in the hair loss space, pertains to or is relevant to those who have male or female pattern hair loss. So there's an androgenic component to it, androgens being sex hormones, so testosterone, DHT. So DHT is a factor if you have male pattern loss. Who has male pattern loss? Well, about 95% of men who are balding because of male pattern hair loss, which there is an underlying component to it where DHT is a big contributing factor. Now, DHT sensitivity, which I mentioned, why is this relevant and how does this come about? Why are some people more sensitive and other people aren't? Well, this is a genetic predisposition. So you inherit it from either mum or dad. So it's not just your mother's father, as was once sort of, joked about or spoken about amongst certain circles. You can inherit your genetic predisposition to the sensitivity from either your mum or your dad. Now, if you have two parents that have got a genetic inheritance or a male and female pattern loss, we can have quite advanced hair loss at a much younger age because of that sort of dual inheritance. So your DHT sensitivity and how you respond to DHT at your hairline is inherited from your parents, and it can be either parent. Now, you've mentioned in there, you've asked about scalp tension and what the relevance is there. And some people are saying scalp tension, some people are saying it's DHT. Well, in actual fact, there are theories to suggest that there is some component around scalp tension leading to an increase in DHT in the scalp. Now, the theory exists around the fact that you have this connective tissue. So connective tissue is like a tight kind of tissue that exists in our body, and it's connecting two muscles. So it's connecting the frontalis muscle at the front and the occipital muscle at the back of your head. So it's essentially a helmet of this particular type of tissue under the skin, and it's attached to the skin, and it's tight. And if it's tense and tight, well, it's considered that this can lead to an increase in DHT in these areas where there's most tension. And where there's most tension in this particular piece of connective tissue or aponeurosis is at the front and in the temples, and then in the occiput in the back of our scalp, which correlates to where most men will see a progression of loss sooner or earlier in male pattern hair loss. So from the frontal hairline, recession in the temples, and then in the crown. For some people, it's the other way around. It's not always uniform and the same size, a one size fits all approach. For me, it was more so the crown than the front. So everyone's slightly different. However, your sensitivity in this area, matched with a higher amount of DHT in this area, for some, may well be big contributing factors to your hair loss. So the tension component to it is why people talk about the benefits of certain things like scalp massage, botulinum toxins, the bands that people put around the scalp to release tension. So yes, whilst tension might contribute to DHT in this area, or the production of DHT or the release of DHT in this area through chronic inflammation, the general consensus on male pattern hair loss is due to DHT sensitivity in the hairline, so on the top of the scalp. And there is a genetic inheritance which leads to this. Now the next point here is you'd said that you'd had blood tests and your DHT was actually low. So I can appreciate that that presents a bit of a confusing picture. You've got hair loss, progressing hair loss in a DHT pattern, but yet you've had blood tests in your DHT and your DHT has been reported as low. Well, there is limited utility in blood tests with respect to DHT and testosterone, because it's not just about the concentration of DHT in your blood, especially not systemically, but the concentration of DHT at the level of the scalp matched with, and most importantly with, a genetic predisposition to sensitivity to that DHT. So I have, lots of patients that have had blood work done previously, and they do have low DHT. Some of them have got low testosterone, and they're like, "Doc, I don't get it. How can I possibly have hair loss if I've got low testosterone, low DHT with the things that are leading to the loss?" So these patients are obviously particularly sensitive to DHT at the scalp. So what that means is that when that DHT binds to the DHT receptors or the androgen receptors on the hair follicles, it shrinks them, it miniaturizes them, it reduces blood flow, it basically reduces the life support to the hair, so the hair doesn't grow to its full potential. And progressively over time, that hair will feel more like baby hair, and then even further into time, the hair just won't grow in that area at all, and the follicles will become dormant and essentially shut off after a couple of years. So having low DHT in blood tests is only representative of your blood at that point in time, which is another thing I'd say. Your DHT levels go through multiple peaks and troughs throughout the day. So, it's not an accurate representation of what your DHT levels actually are in general, just to have a test at one point in time, because they fluctuate so much throughout an average day. So DHT sensitivity is really important to understand, more so than just what DHT concentrations are reflected in your blood. So the next point I'll go on to is you asked about supplements and the benefit of supplements versus taking finasteride, and what were the pros and cons potentially of both. Well, look, some people do take supplements. There is limited evidence to suggest that just simply taking a supplement, and if we're talking about supplements, I'm talking more to sort of micronutrient supplements like zinc, folate, vitamin D, iron, etc. Unless you have a deficiency, there's limited evidence to suggest that it's actually going to be the thing that will help reverse hair loss or slow the loss. By all means, if you are deficient in these things and it's been picked up in your blood work, getting them back to within a normal range is definitely going to have, great utility within your body overall, and not just benefit your hair, but overall entire system will benefit from having these things within normal range. If you're asking about things like supplements like saw palmetto, pumpkin seed extract, pygium, stinging nettle, these sorts of things, yes, there is some evidence to support that they can have some effect, or they can have some benefit to those that have male and female pattern hair loss. They're not as effective as finasteride or dutasteride in reducing DHT effects. However, they generally, have some impact on about 40 to 50% of people, is what the study sort of collectively says about, saw palmetto and pumpkin seed extract. I'll post a couple of links in the show notes so you can read up on those. So what I'll say is that if your hair loss is progressing rapidly and you're losing hair quickly, you're starting to see scalp on show through the hair, it's progressing rapidly, you're also losing hair in these areas, so you've got both shedding and thinning, and it's happening quickly, irrespective of whatever you do, it's really important to talk to a hair loss professional so you can get better guidance, and they can actually tailor this to what your personal preferences are, and also take into account your medical history, which is so important. Now, the thing I say about supplements is why, if I just sort of stop using the word supplements and I talk more about sort of DHT blockers that are things like saw palmetto, pumpkin seed extract, we'll talk about those two to begin with. So if you are early in your hair loss, and you're one of the people that loses only 1% of the hair volume a year, not 30% of the hair volume a year, which can be the case for some men. The average is 5% hair volume loss per year. So if you're in the category where you're losing, 1 to 5%, well then sure, okay, if you're losing 5% in 6 years' time, that's, a third of your hair volume gone. So depending on how rapid your hair loss is, would lead to you then maybe taking more assertive action sooner. So if you're losing hair at a heck of a rate, I would then potentially be looking more at DHT blockers from the pharmaceutical space. However, if you're early in your hair loss stages and you're worried about the potential risks and side effects of taking, a DHT blocker or using a DHT blocker in your scalp that is pharmaceutical in nature, well then things like saw palmetto and pumpkin seed extract are definitely something that you should look into. I've made a number of videos on these which you can look at if you just go through my shorts, and I'll link them here. But you can use pumpkin seed extract, saw palmetto, you can use these topically, you can take them orally, and they do have some benefit in a significant number of people. However, if you have significant loss, it's rapidly progressing, this is a situation where you need to weigh up what are the benefits versus the risks, and then also what are the benefits versus the risks long term. So my view, my personal opinion, having had finasteride, minoxidil, saw palmetto, pumpkin seed extract, having had all of these things, and unfortunately having suffered, post-finasteride syndrome and having had finasteride related side effects, minoxidil related side effects for a long period of time, I'm really judicious around when I prescribe DHT blockers from a pharmaceutical of a pharmaceutical nature, because there are potential side effects that can have a significant impact on the individual. So when I prescribe these agents like finasteride or dutasteride, I start with very, very low doses, and I just do so topically. I reserve very, very, very seldom do I ever prescribe oral hair loss drugs like finasteride or dutasteride. If I was to ever consider it, it would be because someone has tried everything else. They've tried the topical finasteride, dutasteride, they've tried all sorts of other things, and they're still not stabilizing their loss. Then there's someone that might need to start on a low dose of finasteride or dutasteride, sort of 3 times a week, because the finasteride is actually active in your system for 30 days plus, dutasteride even longer. So you don't need to prescribe these at the same cadence as a lot of people throw out on TikTok, 1 milligram a day. You actually get a lot of benefit from 0.25 milligrams, 0.5 milligrams of finasteride when you take it, Monday, Wednesday, Friday. But I'm going to do another video just detailing finasteride and dutasteride and dosing regimen and side effects and these sorts of things in another video, so I won't dig too much into this right now. But if you were to use finasteride topically or you have to use dutasteride topically, you have 100-fold lower concentration of that drug in your system than if you were to use it orally. If you were to use the same concentrate, the same dose orally versus topically, when you use it topically, you have 100-fold lower concentration in your blood. So in theory, there's a much lower side effect profile. It then gives people reassurance and peace of mind that then, okay, I'm taking the least risky approach. And it also leaves things up your sleeve that if you plateau, which is the likely situation for most people, first year of taking oral finasteride 1 milligram a day, 89% of males are getting results for male pattern hair loss. Second year, 82%. Fast forward to fifth year, only 64% of people are getting results from that oral finasteride. So these aren't a long-term solution for everyone. There is going to be a period of time where people will find they plateau or they start to regress. So what I like to do with patients is forecast that and have things up my sleeve. So if we start with absolutely every single thing to begin with, and you can see me divulge just a little bit more as I talk about the 5 common mistakes people make when treating hair loss. Check the video out there. If you throw absolutely everything at it from the beginning, well, then what does that leave you up? What does that leave you up your sleeve when things start to plateau or progress? So my approach I like to take is start early. Start with supplements like saw palmetto, pumpkin seed extract. Look to introduce a dermal roller, 1 to 3 times a week, 1 millimeter. So you get penetration into where the hair bulb is and where you've got the stem cells surrounding, which is between 0.6 to 1 millimeter deep, sometimes a little bit deeper, but I think if it's too painful, people aren't going to keep up with it. So a 1 millimeter dermal roller is optimal. Then if you find that you stabilize the loss and you promote a little bit of growth, that's good. If you find actually that you're not stabilizing the loss after 6 to 8 months, then it's really important that then you would look to potentially introduce something like a DHT blocker topically, whether that's natural, whether that is something like, dutasteride, finasteride. That might be the option for you, just topically on a smaller dose, and then see if you stabilize the loss after 6 to 8 months. And then if that's not working, then you might need to look at introducing other things. So I won't go too much into how you should treat your hair loss because I'm not your treating doctor. And as I said earlier, it's really important anyone who's treating hair loss should get guidance by their health professional. But my approach with my patients is we take the general pharmacological, general medical approach, which is start low, go slow. So the earlier you can catch your hair loss, the better. But I feel the hair loss space is flipped upside down on its head. Most people get started on big doses and they get started on frequencies which they don't need to be on, daily. For instance, for a drug that's in your system for 30 days, you do not need to be on it daily. Not every 30 days, but you can be on it, like I said, 3 times a week. So people get started on doses which are too high, that they're taking too often, and they get started on the oral version, not the topical version, and they don't even get tried on any of the alternative natural routes. So I'm a big advocate for starting sooner in your hair loss journey, starting with natural alternatives first, and then slowly introducing things, graduating up through those doses as and when you need to, not just throwing the kitchen sink at it. So there is obviously a fair bit for you to ingest there. I hope that answers your question. I've tried my best to break it down into those various points that you've asked there in that question that you put forward, and thank you for your question. What I'll finish with is most important is that if you're struggling and you don't know where to turn, it is so important that you get guidance from a health professional that is focused on hair loss. Hair loss is their field of choice. So those are the people that you need to be turning to because they can guide you and also take into account your medical history, which is so important because other things can be also contributing to the loss. So please just take this as informative and educational. It's not a replacement or a substitute for you actually having guidance by a health professional. Anyone who's watching this that might be interested in learning more about hair loss, we have a hair loss ebook, which was produced by a medical board, which has over 75 years of experience. And this can guide you through all the various treatments that are available and will give you good perspective on what are the benefits and the risks to all available treatments from, alternative supplements, hair loss drugs, PRP, HRP, which is what our trademarked approach, the hair restoration protocol, and then transplants. So if you want to get your hands on this, just like, subscribe, comment, and reach out to me on Instagram at Dr. Jonathan Hopkirk, and I will send this over to you via email. I hope this video has helped give you a bit of understanding around some of the hair loss confusion that exists and some of the difficulties in navigating the hair loss space. If you have any questions personally, you want to fire them over, I'm happy to answer them at any time, and we'll just continue to post videos like this from questions I get from my patients in clinic and questions I get online. Cheers.